Good afternoon. I'm Jim Donchess, Mayor here in Nashua, and I'm here with Bobbie Bagley, Director of Public Health and Community Services, in order to update you regarding COVID-19 here in Nashua, the COVID-19 pandemic, regarding our efforts to fight the pandemic, eradicate it and eliminate it as much as we can, and of course the vaccinations and everything that is beginning now. So I've set up some slides for you, and hopefully you can see these as I go through them. First, we wanted to give you just an update on the number of cases that we've had here in Nashua and the number of active cases. As you can see from the slide, since the beginning of the pandemic, almost a year ago, we've had almost 5,700 cases in Nashua. Most people have recovered. We now have 480 active cases. Now, our public health nurses, who are doing a great job in fighting this pandemic, are in contact with those 480 patients, and Ms. Bagley will be able to tell you more about that. We are now, in terms of the testing that's being done in the city, this includes the weekly test clinic that Public Health runs on every Tuesday afternoon down at the Nashua Armory, as well as all the testing done by private sources, doctors, pharmacies, and the like across the city, where we are testing close to 500 people a day. The positivity rate, meaning the number of people who test positive, is about 10%, and that is a 7-day average. Unfortunately, something that I don't see on this slide, about 70 people in Nashua, Nashuans, have died as a result of COVID-19 infection. Of course, this is a tragedy for 70 families. We feel very badly for them, and we want to reach out and let them know that we care for them and that we know that they are really feeling the loss. One of the lost people was a city employee, a very popular, hardworking city employee by the name of Andre Pelletier. He worked for Public Works. He worked in that department for 46 years. He did a great job for the city. He was very well liked, and he passed away within the last couple of weeks as a result of COVID-19. He contracted it somewhere outside the workforce, outside of work, and all of Public Works is just feeling his loss very much since that tragic event. Now let me take you to the next slide just to show you sort of the progression of the disease in Nashua. As you can see, this one is entitled COVID-19 Update, Case Counts by Week. So this bar graph shows you the number of cases per week that we've encountered here in Nashua. Now, as you can see, back in the spring when we thought we were getting a lot of cases in April and May as the kind of the first surge of the virus, we were actually getting far fewer cases then than we are now. Things slowed down over the summertime, but as the medical experts have told us, and it predicted, the number of cases have climbed as we've gotten into the late fall, into the winter, into December and January. So we are now getting more like 400 cases a week. Back in the summer, it was just in very small numbers. But you can see from the bar graph the way the number of cases is progressing. Now, I want you to know that in fighting the pandemic, we are following the science. We are working with our experts, our public health experts, listening to the medical experts, and I think that's what you want and you deserve. Of course, we all want to keep people safe, and we all want to open our economy as soon as we possibly can. And to achieve all that, what we need to do is continue to listen to our medical experts. And what they tell us is that until everybody is vaccinated, wearing the masks is very important in protecting you and protecting everybody else, protecting our family, our friends. I'm even wearing a double mask now, which experts are saying provides more protection in both directions. So we hope you will continue to wear your masks, exercise social distancing and do other measures to make sure that the transmission of the virus is held to a minimum. Now, the next slide I wanted to show you was the percent positive graph. As you can see, when this epidemic, and again, this goes back to the percentage of people who are tested in Nashua who end up testing positive. As you can see, early in the pandemic, that number was very low. Over the summertime, it was very low. But as the year has progressed, the percent positivity rate certainly went up considerably, to the point where we were over 15% early in the year. Now, in recent weeks, the positivity rate has declined down to about 10, as I said, and this is a 7-day average. The thing that this graph shows us to some degree is that the medical experts told us that even informal family gatherings around the holidays late in the year would probably result in more cases. And we can see that that may have occurred because the positivity rate, as well as the number of cases, really peaked in late December and early January. But this is an important measure. We want to see this. We want to see this measure go down as much as we can. We continue to work to try to limit the spread of the virus. Now, Bobbie is going to talk to you more about what's happening in Nashua, but I wanted to show you a few slides that I thought are interesting, that you might find interesting, that I saw in a presentation by a doctor by the name of Andrew Picos. Andrew Picos is a professor of molecular microbiology and immunology at the Johns Hopkins Bloomberg School of Public Health. Now, he is Johns Hopkins is a very well-established and leading expert with respect to contagious diseases like this one, and Dr. Picos is a very knowledgeable expert. And so these next 5 slides I'm going to show you, he developed. This is not me or Nashua, but he developed these slides. And I saw these as part of a Bloomberg leadership program that I'm involved in, and I thought they would be interesting. The first asks the question, what is a virus variant? And what it tells you is that any virus, like this coronavirus, like COVID-19, mutates constantly into slightly different forms. And we have now, and I think you've heard about this in the news, that there are some variants that have come from other places that are more contagious, can be transmitted more easily than the strain of the COVID-19 virus that's been here for a long time. You can see out from the slide that there's a UK, meaning, of course, United Kingdom or a Britain variant that has mutated considerably. There's a Brazilian and South American variant, again, another mutation. It's unclear whether these transmit at a faster rate, but there are various, and they're giving an example here of other variants, that the mutations of the COVID-19 virus that may be more contagious than the one we're used to. The next slide I thought was interesting. It just asked the question, how did this virus variant happen? And it just points out that all viruses mutate at a particular rate, and COVID-19 appears to mutate every week or so. So there's a slightly new variant of the virus every week or so. And you can see the diagram of the molecular structure of the COVID-19 virus. The next slide asks the question, do virus variants mean COVID-19 is more contagious and or more harmful? Again, it says that, the slide says, again prepared by Dr. Picos, that some of these new COVID-19 variants, the new strains of the same virus, appear to spread more easily than the variants that have been around for a long time. However, it does not appear, according to Dr. Picos, that the new strains are more fatal. But what he does point out is that if more people get the virus, these new variants, because they're more contagious, if there are more cases, then there are going to be more fatalities, not because the disease is more deadly, but because more people get the disease and a certain proportion of people end up passing away as a result. So the slide reiterates: wear masks, do physical distancing, avoid crowds. These are the steps that we need to take to avoid the spread of the COVID-19 virus. Now, we know that the state is making, and the CDC, the federal government, are making vaccines available. We're now on group 1B, which includes, and those are categories created by the CDC, or Center for Disease Control, in the state of New Hampshire. 1B includes citizens that are over 65, as well as people who are medically vulnerable as a result of a couple of other medical conditions. And to sign up for the vaccine, you need to go onto the state of New Hampshire's website. Vaccines are being administered already in Nashua, out at Nashua High South, and appointments are being made for people in Group 1B, those who sign up through the state. But this slide asks the question: will the vaccine still protect against the COVID-19 variants? In other words, will the vaccine protect you against these new strains? And the answer is yes, it will. Maybe not quite as effectively as against the original strain, but the vaccines appear to work against these new mutations of the virus. Although, as the slide points out, they might not work as efficiently. So the need, and the slide points this out, is to track the new variants to determine whether changes in the vaccine are necessary. And of course, Johns Hopkins and the CDC are going to be working, and the companies developing these vaccines are going to be working to try to determine definite answers to those questions. And the final slide that Dr. Picos, that I brought from Dr. Picos, asks the question: if you've already had COVID-19, are you still susceptible to the new virus variants? And the answer there is that you still need to get the vaccine. Even if you've had COVID-19, the vaccine you might have some immunity. But the vaccine will provide you more protection than any immunity that you've developed as a result of having had COVID-19. So the slide concludes: getting a vaccine even after being infected is recommended. So that underlines the fact that everybody needs to get the vaccine. Now, I'm part of Group 1B, and I have signed up later, in February for an appointment. I intend to get the vaccine, given the testing that has occurred and all of the trials that have been done. I mean, I'm confident, along with the medical experts, that the vaccine is safe and will protect people and save people's lives. So I urge you to get the vaccine as soon as you can, and help save yourselves and protect yourselves, your family, and of course everyone else in the community. Now, I think I want now to turn the briefing over to Director Bagley, Bobbie Bagley, Director of Public Health and Community Services, who's of course very knowledgeable and has been very involved on a 7-day-a-week basis in fighting the COVID-19 pandemic since last February. And again, before I bring her up, I want to again say that I greatly appreciate, and I know we all do, her efforts and the efforts of all the public health nurses and the public health department in helping keep Nashua safe as we possibly can. So with that, I'm going to bring Bobbie Bagley up, and I'm going to take my mask with me and put it on as soon as I get over to the side.
I'm going to provide a COVID-19 update situationally about what's happening globally, a perspective on the U.S. side as well as in New Hampshire. So globally, we see cases have gone over 100.5 million, and our deaths have gone over 2.19 million globally. In the United States, we have gone over 25.7 million cases, and we've experienced 433.2 thousand deaths. In New Hampshire, our number of cases, right now, there are 5,374 active cases, with a total cumulative case count for us at 64,258. Our recovery rate has been high at 91%. Our hospitalization rate has been at 1.5%, and we have experienced 1.5% of deaths associated or related to COVID. So we've had over 1,000 individuals in our state lose their lives to COVID-19. If you look on this map behind me, it shows the rate of New Hampshire new cases per 100,000 per population for the last 14 days. And if you look on the bottom of that map, that very dark blue is Nashua. And the significance of that is that Nashua still remains the bluest spot on the map because we have had, over a 14-day period, 626 cases, and there's at least 166 that they're still evaluating the results of those cases. But we're still in the blue, and that's the dark blue. And what that means is that we still see substantial spread and substantial numbers of cases in the state of New Hampshire. In New England, the average daily case rate is shown here. And again, you can see the variations of the colors that go from 0.21.5 all the way up to 93.9. New Hampshire, as you can see, is somewhere between the 48.7 and 59.5 average daily cases per 100,000 in the past 7 days. There's quite a bit of spread and activity that still continues, which is why we still continue with our messaging around our vigilance and wearing our masks, social distancing, and making sure that if we're sick that we stay at home. And we do the hand washing and all the things that we know that we need to do to reduce the community impact of COVID-19 in our cities across the state. There on the state's website is activity that shows daycares, businesses, our nursing homes, assisted living, employees at different types of businesses, for-profit, nonprofit, families and hospitals continue to be impacted by this virus and this infection. We do see quite a bit of community spread continuing, and what that means when we do our investigations, if there's no identifiable risk in a particular workspace or place, the individual has picked this virus up somewhere in the community, and that's why, again, our vigilance is needed. As far as our local hospital updates, hospitalizations have been on the rise, and as it was mentioned, we continually see deaths. We had I want to say there was between 12 to 17 new deaths that were reported. That data is actually captured on the state's website. Hospitals have been well equipped with personal protective equipment. Staff continue to monitor their own symptoms and monitor isolation and quarantine status. And it takes all of us working together to really make an impact on what we're seeing in the hospitals. When we can help bring down that community spread rate, it helps us reduce the burden of disease and the burden of what needs to take place in the hospitals, in their ICUs, or through their emergency rooms. One of the things that we also want to continue to stress is that we don't want individuals to use the emergency room for COVID testing, because then you have to go through the emergency room for a complete assessment, and that can be done at one of the local testing sites that are around throughout the community. We have moved into another phase of our mitigation. So we started out with the masking. We started out with the social distancing. We started out early in March with the shutting down of businesses. And as things tapered down and we flattened our curve, businesses were opened up. When those businesses opened, we asked for people to work with us, again, on those mitigative measures of the social distancing and the wearing of the mask. And now we're moving into the vaccine phase. As of Friday, January 22nd, all New Hampshire residents were able to log on to a link at vaccinesnh.gov to start registering for vaccinations. On the slide that we have here, it shows which phase we're in, which is in 1B. And we want people to know that that is where they can go to click on that link to be vaccinated if you fall within the category of 1B. So that's individuals that are 65 and older, individuals that have medically vulnerable conditions with 2 or more comorbidities, and those are listed again on the state's website. It's also listed on our website under the city's webpage. Individuals that are family caregivers of medically vulnerable individuals under the age of 16 can also register for the vaccine under phase 1B. This phase also allows for individuals that are residents and staffs of residential facilities, for people that have intellectual or developmental disabilities, also included under 1B. Correctional officers and staff in correctional facilities, as well as first responders and healthcare workers that were identified in 1A that have not been vaccinated, can still sign up and continue along with this phase. Phase 2 will occur beginning from March through May, and under that phase, there are 2A and 2B. It's when K through 12 school and child care staff will be vaccinated, as well as people between the ages of 50 and 64. And in phase 3, again, 2 phases, A and B, May and beyond will allow for all others to be vaccinated, including those from those other groups that have not been vaccinated. So we do have a road ahead of us where we are focused on making sure that we can get as many people vaccinated. We want to get vaccine in arms. Currently in phase 1B, again, registration is at vaccinenh.gov, or you can also call 211, and these options are available because we do realize everyone may not be able to access registration through a computer, but you can call 211 and they will walk you through that process. If you want more information, you can also go on nashuanh.gov/COVID-19, and we have information and instructions on how to navigate through those sites as well. And you can also call us on our hotline at 589-3456. As far as vaccination updates, and we get plenty of questions on our hotline about who, when, and where. Only New Hampshire residents are eligible for vaccine in New Hampshire. And the reason for that is because the federal government has made allocations across the country based on populations per state. And so individuals, according to where they live, are have the ability to register in those states for the vaccinations. When you go to the vaccination site, once your appointment is assigned, you must bring at least one document that shows your New Hampshire residency. And it could be a driver's license. It could be mail that you get at home that's a pay stub or employment, or it could be a government-issued identification. And it just has to show that you have a New Hampshire address. We, in the greater Nashua Public Health region, our public health department is the lead, and we have the responsibility and the charge of providing vaccination clinics that are mobile clinics. So there's the fixed site that's at Nashua High South that's being run by the National Guard, and that's a state fixed site. And then the public health regions across the state will be offering mobile clinics in the community. And that's, again, to make sure access is available for everyone. We're trying to make everything equitable for individuals to access the vaccinations. So we're going to focus on or look at residential programs for seniors that are not able to either drive or get to the fixed site, for populations that are disproportionately affected or impacted by COVID and have been over the past 11 months that we've been in this pandemic. This will also include clients that are participants of organizations that serve individuals that have intellectual or developmental disabilities and their staff. We're also providing and will continue to support, again, phase 1A with healthcare providers and first responders. Our public health network coordinator will be coordinating those clinics for our region. One of the key things with this, as we move through these phases, we will get through this. And thank you all for those that have made the sacrifices that you've had over the past 10 months. We still have to maintain our vigilance, continue to make those sacrifices for the health and well-being of our families and our community. We also want for people to understand, as the vaccinations are rolling out, your first dose of vaccine, after you get that dose and in between the 21 and the 28 days, you still need to make sure that you're wearing your mask. You still need to make sure that you're doing your social distancing. And even after you get your second dose, it takes up to 2 weeks after that second dose for the vaccine to be at full efficacy. So we're asking people to even continue, wear your mask, maintain your social distancing, and make sure that you wash your hands often when you're out. We still want folks to maintain those social bubbles, right? Because we've seen over the course of the holidays, even small gatherings with individuals that were not a part of your social bubbles allowed for there to be exposure, to family and friends. So we want to make sure that people still remain vigilant around that as well. If you happen to have an exposure and you've been made aware of an exposure or someone has called you, thank them. And then what we want you to do is monitor yourself for signs and symptoms, and then also schedule yourself for COVID testing. Testing is still very important as we continue to see what the impact or what the spread of the virus looks like in our communities. Make sure that to reduce those exposures, again, 6 feet, social distancing, and wearing your mask. If you've had exposure to anyone and it's been less than 6 feet for 10 minutes or more, even with wearing a mask, we're still asking for you to monitor signs and symptoms and to get tested. And if you've been exposed to a positive confirmed case, we are asking you to quarantine. We want individuals to stay at home for 10 days because, again, that removes the virus from the community. Avoid any contact with individuals that are outside of your household. Continue to monitor yourself and watch for symptoms, and then get tested between 5 to 7 days after exposure. If you get tested too soon, you might end up with a negative test because it may not pick up the virus. Complete your 10-day quarantine, even if your test result comes back negative if you've been exposed to a positive case, because that's that incubation period. Individuals that are excluded from the 10-day quarantine if they're exposed are individuals who have completed their vaccination series, which means they've had their second dose and they're 14 days past that time, and individuals that have had COVID and it's been 90 days past their previous infection themselves after completing their full isolation. Again, if you have any questions or need clarity on this, just call us on our hotline at 589-3456. Because we're still seeing very mild disease in our community that continues to allow for community spread, if you have the mildest symptoms, we're asking you to do testing to rule out COVID and then stay home and seek medical attention. Avoid contact with people outside of your home until you have gotten your testing back. And if you've had fever, if you're fever-free for at least 24 hours. For us here, we've been doing a great job working together as a community. We're asking you to just continue that vigilance of working with us, working together. Our personal responsibility allows for us to have a better future as we get over this hump and as we get through and get everyone vaccinated. Face coverings are required we still have our masks mandate, and so we do want people to be knowledgeable of that and to adhere to that ordinance. Our testing site is still open on Tuesdays. We're offering testing over at the National Guard Armory from 3 to 5 p.m. That's located at 154 Daniel Webster Highway. You can still go on our website and click on the link and register for that test, or you can call us on our hotline if you're not able to connect through the web. That appointment is free, and we do encourage folks to continue to do that. www.nashuanh.gov/COVID-19, or again, 589-3456. Thank you. We wish you good health as we all work together to rid ourselves of this virus.